Yep, and then Julie.
And we've actually got tape marked for you. Yep. Oh, were your remarks? But I'll get us started. Can you get them in? We're a little cozy here. We're a little tight. Let me get.
There we go. And they told me to be thoughtful of not appearing right now. You guys are crushing it.
All right, everybody, we're going to get started in a couple of seconds. If you can take your seat. Thank you so much. All right, I want to give you a little rundown about what to expect. We have a couple of things, a couple of beats in this event. We're going to start off with some remarks. The governor's going to kick us off. After the speaking program, we'll move to the desk here. The governor will sign some exciting bills, and I will invite everybody to come up behind her, and we'll take pictures. We'll take pictures with our camera, and we'll make sure to send them to you, so don't worry. It'll be a nice picture. Lastly, before we close, we'll be doing a photo line with the governor, so everybody can get a photo. Before departing, I recommend doing it in groups, so that we can be really efficient. And I think that's it. So take it away, Governor.
Yeah. Thanks, Roxy. Good afternoon, everyone. Good afternoon, everyone. Come on. Yes. It's so great to be with all of you here today. I want to first start off by thanking our hosts, the fantastic team here at Fora Health, Devarshi and all the team. Thank you. You know, the First Lady and I were here, I don't know, a couple months ago, and we took a tour, and we talked with staff, and we looked at not only this beautiful place, but what the vision is and what's happening here, and the innovative work that's happening here at Fora Health is really a model for not only our state, but our country, and we're just really thankful for everything you do here every day to take care of Oregonians, so thank you. Really appreciate it. You're going to hear a lot of thank yous today. I want to start off by thanking all of our legislators. We have a bunch of them here today. All of our advocates, all of our providers, all of our family members, our peers, everyone who is out there who worked hard leading up to the legislative session, during the session, to bring the legislation and investments that we're going to be talking about today to fruition. We would not be here today without all of you. So thank you. This is a huge day for us to celebrate hard work together to get things done. I feel like sometimes when people say, what do you do? I'm the closer. I just come and thank you all. I also want to thank Oregon's First Lady, Amy Kotek Wilson, who is going to say a few words. The First Lady has been advocating for quite a long time, but also advocated in the session for improvements to our civil commitment statute, and she is also chairing my Behavioral Health Talent Council, and they're going to bring ideas to all of us in January of next year about what we can do next to support our workforce. So thank you for everyone who's here who serves on the council. Appreciate that work. So we're going to sign 4 bills today, 4 bills that taken together really show the way we have to approach the challenge of making sure that people have the access to health care that they need. These 4 bills are about better approaches to how we serve people who are in crisis. It's about more resources for treatment and for supporting our workforce. And it's also about prevention, going upstream to take care of our young people before their lives get a lot more difficult. And together, these bills are an important step to make sure we can have an Oregon where people are healthier and safer. This year's legislative successes get us closer to the vision of an Oregon where we focus on more prevention and intervention, helping people get the care they need, when they need it, no matter where they live. This is a journey, and all of you have been on this journey with us, and there is more to do. And I'm thankful for everyone here who knows that what it takes to keep going until we reach that better future for everyone in our state. So of the 4 bills, I'm going to start off and just mention them briefly. House Bill 2005, which is our very substantial policy bill for the session. When you take that bill and you pair it with the $65 million in investment in House Bill 2059, which focuses on treatment capacity, those 2 bills together are about making a course correction here in our state about how our system can do a better job helping more individuals who are suffering from acute mental illness to make sure they get the care they need. These bills will lead to better outcomes for people in crisis, and they will lead to better outcomes for all of our communities. House Bill 2024 is the bill that focuses on supporting our essential workers who are in the field, in the mental health and addiction care field, making sure that people can get the help they need. There is $6 million connected to that bill, which will continue some grants that have been very important for recruiting and retaining workers across the state. And there's also a renewed commitment to workplace safety in that bill, and I want to particularly shout out to ASME for your work on the workplace safety. So thank you very much for that. When the First Lady and I were visiting providers around the state on our One Oregon Listening Tour, we heard time and time again about the struggle that we have here in the state retaining the workers we need to help Oregonians. And again, I want to mention that our Behavioral Health Town Council that is working really hard right now is going to be that next step of saying, what more can we do to get people into the field? And you're going to hear a little bit about that today, but stay in the field, because we can't do all this work unless we have the people helping individuals in the care they need. But at the end of the day, we also have to focus on prevention. And so House Bill 3321 is our focus on prevention. It requires the Alcohol and Drug Policy Commission to develop and implement a statewide substance abuse prevention plan with a focus on our youngest Oregonians. The rates of substance abuse, the rates of overdose deaths for our youngest among us is unacceptable. And we need to focus on prevention, and we are going to do that with House Bill 3321. It's going to allow us to marshal all of our efforts towards prevention on data-driven solutions that will actually make things better for our young people. And I'm very excited about the work that's going to come from that bill. None of these bills today would be here without all the hard work of people in this room. And I want to particularly call out our lawmakers who worked really hard. There was a lot going on in the session, but we landed these bills because of their tenacity. People like Representative Krupp, Representative Nose, Representative Walters, Representative Sanchez, Representative Anderson, Representative Isidore, and Senators Lieber, Przansky, and Reynolds. Thank you for their work and your work for those who are here today. And one more thank you. I really do just want to have another thank you to our provider community. I really appreciate what you do. And I want you to know that we know that you confront some very difficult situations every single day, and you show up every day with wisdom and compassion, and you are helping people heal and get better, and I so appreciate that. So thank you to our provider community, and with that, I'd like to cede the stage to the next speaker, the First Lady of Oregon, Amy Kotek Wilson.
Good morning. I'm First Lady Amy Kotek Wilson. As someone who's worked directly with Oregonians experiencing a mental health crisis, I recognize how impactful this moment is. House Bill 2005 represents our collective effort to make sure that when somebody is experiencing an extreme mental health crisis, providers have the tools that they need to intervene and deliver care. I want to thank NAMI for their extraordinary leadership on the challenge of compassionately improving the state's civil commitment law. Their advocacy and partnership made changes possible, and their work will undoubtedly save lives. To the individuals and families who courageously shared their stories during the legislative process, your voices were the heart of this effort. You transformed personal trauma into public purpose, which took tremendous courage, and we are so grateful. This day is all about ensuring that Oregonians experiencing a mental health crisis receive compassionate, timely care when they need it most. Thank you to the legislature for their thoughtful work on the complex issue, and thank you to everyone who will help implement this law with the care and dignity that every person deserves. During my travels across the state of Oregon with the governor, I had the opportunity to talk with mental health providers and families in every corner of our state. They shared their struggles, their hopes, and their need for change. Today's event is about responding to those stories. The comprehensive approach of the bills being signed today will help us all make progress. Let's keep going together. Thank you.
Ooh, hard act to follow. Hi, my name is Kate Keckler, and I recently graduated from Eastern Oregon University's Clinical Mental Health Counseling program. Woo! I want to thank Governor Kotek and the Oregon Legislature for supporting the behavioral health workforce and higher educations like the EOU program. I wouldn't be a behavioral health provider today without state tuition assistance, which is one piece of the legislation being signed today. Partway through my degree, my daughter suddenly needed a new wheelchair, and despite having insurance, the copay was high. Without the scholarship and tuition assistance, I would have been forced to choose between her essential needs and continuing my journey in school. I'm lucky I didn't have to make that decision. I feel so proud to work in community mental health today. We serve clients on Medicaid and who are low income, and we don't turn anyone away. My colleagues and I are dedicated to this work, but every single day we feel the weight of a system that doesn't have the capacity to help every person who might need it. In rural Oregon, this crisis hits especially hard. That's why the investments in capacity of our behavioral health system being made today are so meaningful. To me and other providers, it confirms there'll be a future for us in this difficult field, and that our state leadership is committed to making sure of it. And to every client who would have been stuck on a dangerously long waiting list, they'll now be able to receive the care they need when they need it. Thank you, Governor Kotek and the Oregon Legislature, for making sure that Oregonians get the care they deserve.
Hi, my name is Shelley Turner, and I'm a certified peer support specialist, and I bring something to this work that no textbook can teach: lived experience with mental health, addiction, and recovery. When someone's struggling and sits across from me, they see someone who's been in their shoes. They know I understand the shame, the fear, and the feeling that recovery is impossible. But working in this field with lived experience means confronting my own trauma every single day, which is why I'm thankful for the steps forward the governor is taking today. A statewide substance abuse prevention strategy for youth to stop the cycle of addiction before it starts. Increasing the number of residential behavioral health treatment beds across Oregon so people in crisis aren't stuck in a backlog and we can provide care when they need it the most. Workforce improvements, including student tuition assistance, scholarships, and stipends. So many people with lived experience don't have access to the resources to pay for higher education, but were needed at every level in the behavioral health care system. These bills recognize that people with lived experience aren't just part of the solution, they're essential to it. Thank you.
Good afternoon. My name is Julie Ibrahim, and I'm the CEO for New Narrative. We are a nonprofit mental health agency that provides comprehensive mental health care, a housing continuum, and peer support services. I didn't start out as a CEO, though. Many years ago, my career started in behavioral health as a frontline counselor in Medford. Then I moved to Portland to do the same for New Narrative, and I've been with them for 13 years. I've worked with crisis centers, residential programs, and community-based care. And I've seen up close the urgent needs that this legislation addresses. Every day, Oregonians in acute mental health crisis face an impossible reality. There are simply not enough beds available when they need immediate care. Families wait in emergency rooms for hours, sometimes days, hoping for an opening at a residential treatment facility. Individuals ready for recovery from substance use disorders can't access withdrawal management services during that very small window when they're ready to change. These investments represent so much more than funding. They're hope. They're the promise that when someone reaches their breaking point, we'll have a place for them to heal. When someone is ready to begin recovery, we'll have the capacity to meet them where they're at. Over the next 2 years, the state isn't just adding beds. They're building the workforce needed to staff them effectively and ensure geographic equity so rural communities aren't left behind. They're prioritizing projects that can move quickly because people in crisis can't wait. I especially want to thank Governor Kotek for making mental health a core part of her agenda. And I also want to thank the legislative champions, many of whom are here today, who have worked so hard on these bills, and every advocate, provider, and community member who helped bring us to this moment. Especially our colleagues at the Oregon Council for Behavioral Health, the Tri-County Behavioral Health Providers Association, Oregon AFSCME, the Association of Oregon Community Health Programs, and of course NAMI Oregon. On behalf of the team at New Narrative and the thousands of Oregonians that we serve, thank you for making this investment in Oregon's most vulnerable residents, in the behavioral health workforce that they serve, and in our state's future. Thank you.
Hi everyone, I'm a volunteer at Youthline, a help, support, and crisis line staffed by teen and young adult volunteers who is pursuing a career in the mental health field. While I may not know exactly where the future will take me, I do know that building the behavioral health workforce is essential to building a brighter future for us all. On the Youthline, the hope is to allow youth in crisis to connect with peers who understand what they're going through. Through the training, mentorship, and experience I've gained at Youthline, I've developed valuable insight into the behavioral health field. It's really important that we invest in the behavioral health field, as it will allow more young people to discover it as a passion and help it become a more viable career for them in the future. I feel like these bills will help improve the future of young people in our state. On the crisis lines, I've seen that preventative care truly matters and helps our support go so much further. We want youth to get the help they need before they're in a crisis situation and need our help. The statewide substance abuse prevention strategy for youth adds an extra layer of support that allows us to assist in stopping the cycle of addiction before it starts. I believe this bill will allow youth to have the ability to access preventative care so that if they do experience crisis, they have coping strategies already in place. Thank you, Governor Kotek, for caring about the mental health needs of youth in our state, as it is essential for building a healthier future for us all.
Another round of applause for our wonderful speakers for helping us out today. All right, let's sign a bill. Everybody, let's sign some bills. Okay.
If you'd like to come up, be in the picture, come on up. Come on up.
Here, I'll take that.
I'm so sorry.
I'll move this back afterwards. No worries. Perfect.
I'm going to step behind you. Yeah.
Get on in here. Get on in here. I remember, I know.
Now I can retire.
No, Pam, you can never retire.
I'm tall, so I'll go in the
All
back.
right. I'm not tall.
Yeah. Perfect. Miss Good behind you.
I'm gonna wait because you gotta get like situated. I'm not doing anything till everybody's situated. Do you need us closer? Do you need us closer? No, we're good? Okay. Okay, everybody look that way.
I can see you. Big smiles on 3. 1, 2. All right, ready?
Yeah, everybody come on. Let's go.
All right. Big smiles on 3. 1, 2, 3. One more.
Nice. All right. Anybody else need photos before I sign? No, we're good? Okay. All right, we're going to do some signing.
These are the action shots, right?
Are you doing 2059 yet?
I'm going to shout them out as I go. Okay, we're going to start upstream with 3321.
Governor, who's the sponsor of the bill?
Representative Walters, this is for you. Okay, we're going to House Bill 2005. What a huge labor of love. Lots of folks involved in this. Thank you, everyone. Thank you for all the meetings you're going to continue to have. Thank you. Okay, 2059.
That's me.
That's it. Wow, Nosen Anderson out of the block. Well done, my friend. And then House Bill 2024, let's talk about our workers. Nice work, everyone. Let's have a workforce that can do the job. Yes. Great, and I'm going to hold these all up, I think. Hold on 1 second. 1, 2, 3, 4. Okay, there we go. One more. Everybody shout and scream. Look like you have fun.
One more time. 1, 2. Oh yeah, big smile celebration. Ready? 3.
Nice. Good.
All right, photo line this way. Photo line is this way.
Yeah, let the crowd in.
Line is this way. I'm gonna have folks come to this side.
Okay, and then I'm gonna go with
While we move people, just stay savvy. So that while we get them.
Yeah, I appreciate you. Okay. Perfect. I appreciate you so much. I'm so anxious and you're so kind.
I love it. I love it.
Oh, no, sorry. Be back. Sorry, I was just going to move out.
Be in the front of the line. Okay. My phone, staff has it. Staff is on it right here. Right? Absolutely. Yes. Exit this way, yes.
Shannon's had a presentation right now. Okay, come on up, Joel. And did you guys? Yeah. That's my guy there, so we're going to take this. Yeah, thanks everybody. Yeah, we can print them. Yeah. My phone takes a minute.
We got 3 more people in here. Quick, get over.
So it doesn't make a terrible noise?
Well, I don't mind scratching the floor.
I don't know. Do we need to do anything else? Can I grab one of these pens?
We can be up a little bit.
No, but I'm gonna, can we click the wheel? Because I pushed on it. Oh, yeah, for sure. All right, I'll try ours again.
It is. We can wait. Let's get.
Or they can come a little closer. I just need to be able to hear what they're asking.
Oh, sure, for sure.
So it's a little noisy, so if you have a question, speak up, because I might not hear you.
It's a bit noisy here. So we're gonna, if you haven't done a media avail with us recently. Yeah.
Oh, wow.
That was effective. Thank you. Thank you, everybody. If you haven't done a media avail with us recently, the way it goes is I will call on you in person. We'll switch off with virtual questions. Anka will do it. In person, Anka will also give you our mic so that people virtually can hear your questions.
Am I wearing it in my?
Nope.
No, okay.
Let's get started. Christina, go for it.
Yeah, there's a lot of folks that you had up earlier doing pictures. A lot of folks here are the people that some of these bills are written for.
Yeah.
What can you say about what you're doing to center their voices in this conversation?
It was really wonderful to meet residents here at Fora who are working on their path to full recovery and leaving here and going on with their lives. And what I learned when I came to visit was the work that's being done here is really focused on that individual and that individual's needs. And in the course of our work in developing our proposals, we have included the voices of individuals who have lived experience or who are also seeking that health care on a regular basis. What we have learned in this journey on these issues is that it would be hard to imagine any Oregonian who doesn't have an impact from knowing someone who's struggling with a mental illness or with a substance issue. It affects all of our communities. And so these bills are really lifting up all those personal stories to address the issues of care, when people can get care and where they can get care. And that's, at the end of the day, the bottom line. We have to do better in all those areas to make sure people have what they need. We have in a lot of our places, like the Alcohol and Drug Policy Commission, they work with folks with lived experience. We have a lot of opportunities to hear directly from people who have access to care, because they are the folks who have the best ideas on what they need at the end of the day. And it's been an honor to work with them.
I have a question from the TCS Northwest, Antonia Sanchez. Immigrant communities are currently dealing with mental health issues which can lead to addiction. As the Trump administration keeps instilling fear, Pam Bondi said Oregon and Portland could soon be sued for being sanctuary jurisdiction. How will these bills will immigrant communities will be any culturally specific services or resources?
These bills are about lifting up all of our communities and making sure access to care is there. In the workforce side, we're spending a lot of focus on making sure that the workforce that is serving Oregonians, wherever you live in the state, looks like the communities they're serving. So a lot of focus on the workforce pipeline to reflect the diversity in our state. But I do want to say, regardless of what the Trump administration does, a value here in Oregon is access to health care, no matter who you are. And we're going to continue fighting for that no matter what happens from DC. And right now, we have created strong access points for a lot of people in our state. I want to keep it that way.
Will you wait for the microphone from Margaret? Just want to make sure folks can hear you. Thanks, Senator.
Rural Oregon, outside Portland, Eugene, Salem, Bend, notoriously underserved by mental health services. What do these bills do to address those communities that don't have the infrastructure in place to have facilities like For Health?
Well, we've taken a regional approach in all of these bills. So in the bill that relates to investments in capacity, which is, looking for the bill, House Bill 2059, we're going to take a regional approach in distributing the $65 million. Remember, I led with a request to have a study that looks at gaps in care across the state with a regional perspective. We are following the guidance of that report. And so when you see the investments that come about from that $65 million, you're going to see access capacity being improved across the state. We're not going to solve every problem in the next 2 years, but every 2 years we keep building more, keep providing the workforce to serve in those new facilities, and that is for the entire state. And it's true on the workforce issue as well. It was great to have Kate, who just graduated from the new program at Eastern Oregon University in La Grande, that's focused on educational opportunities for folks to get into the field. We need more of that around the state. So when people are from those communities, they stay in those communities, and then that workforce need in rural communities will be met.
Virtual question, Evan Watson of KW. With these bills expanding access to civil commitment and treatment capacity, will there be enough space for more civil commitment admissions while the state is still prioritizing aid and assist cases at the Oregon State Hospital and under the contempt order? How will Oregon balance these and expand options for these two populations so they're not in competition with each other?
One of the things we heard when we were having the conversations before the session about changes to the civil commit law was making sure that when folks who needed care through a civil commitment process, there would be a place to go. And so we are focused on making sure the capacity money is also being focused to serve folks who might be coming through one system but need a place to go, particularly if they're in the system because of civil commitment. Remember, right now at the state hospital, we have a lot of individuals who are there from aid and assist. As we improve that system and help people move back into their communities and not just be at the state hospital, that will free up places for individuals who might need the civil commitment placement for a short amount of time. We are focused on the entire continuum. So as we improve access to care, we will have the places for people to go.
The bill's hitting on a lot of different points, but all under the umbrella of behavioral health. What should Oregonians expect to see in terms of real change on the streets and in their lives?
Yes. The message for me is my administration is taking on all the different aspects of improving access to care when it comes to mental health and addiction. Making sure we have the workforce, making sure we have the beds, making sure the laws that are in place when someone is really hurting, they can get the care they need, and making sure at the end of the day we're preventing this by working with our young people. So all those things together, we're going to see improvement over the next 2 years. Making sure we can have folks have the place to be when they need care is the ultimate goal. And these bills are going to get us closer, and that's what I hope people take away from this today. Thank you.
Yeah, I have a question from Dick Hughes.
Hey, Dick.
Governor, what do you believe is the value of doing these ceremonies, bill signings, given that you've already signed these bills, legally, you've met those legal boundaries, so why ceremoniously sign them?
I think that these types of events are really important because it gives us a moment, and I only take a moment because I'm always on to the next challenge, but we have to take a moment and celebrate when we hit a success marker. And here, this room was filled with people who have worked months, if not years, on some of the elements of the bills that were passed today. And so as Oregonians, we have to say, we've worked together, we've succeeded, and then we move on to the next challenge. So I think these types of celebratory events are really good for us, as for our soul, to say like, hey, we did something, and we're gonna keep doing it together and work harder. And that's why we do this. Plus you get to meet the great people at Fora, so, it's all good.
Could you please tell me how these bills, especially House Bill 2005, how can they help the people that we see on the streets who are clearly in crisis? And how can we immediately get help for them?
Yeah, so that's one of the issues that I've been following for a couple years now. My wife and I have talked about a lot. As a social worker, she saw what was happening in the field when someone who was clearly in crisis needed to get access to health care. What the advocates did with 2005 as it relates to civil commitment, it's improved the criteria by which you can really be seen to be a danger to yourself. Before, it was a very narrow criteria. So when we see people on the street who might be having a crisis, I think we're going to have a more direct path to saying, hey, let's get you some health care right now, because you're clearly in crisis, and because you're so ill, you might not know it. But if we can get you stabilized and get you somewhere safer, you're going to get better. And that is what the focus of that bill is. We should use it carefully. We should use it prudently. But at the end of the day, it's much easier to help someone before something bad really goes bad. They get hurt or they hurt somebody else. Getting them the care earlier is going to be better for themselves and everyone else.
One last virtual question. This is Yesenia Mara with the Oregonian. Is Oregon concerned, I only have this question regarding Oregon being on a new sanctuary list published by the DOJ. Is Oregon concerned about losing funding or facing any retribution? Has the state received any formal letter by either the Department of Homeland Security or the DOJ?
Well, we haven't received anything new. I am not surprised we're on the list. We have had laws on the books since the 80s that claim and are clear about what we do when it comes to enforcing immigration laws here in the state of Oregon. We are a sanctuary state. We're very clear about that. And as far as I'm concerned, we're going to keep upholding our values and moving forward. And we haven't gotten anything new from the Trump administration regarding that status.
And then, Governor, last week you announced plans to potentially veto $45 million in funds appropriated for the Willamette Falls Trust. Have you been able to determine how the trust used the more than $30 million in past funds, and was money misspent?
I don't believe any money has been misspent, and we are still examining how those dollars, they are still unspent, the dollars from the Metro and from state. So I have another 24 to 36 hours to make up my mind on that potential veto. So.
All right, one last one.
Okay. Yeah, I'm wondering why you had signaled the veto on this. What is your thought process on that? And then do you consider yourself a mediator in a complex intertribal conflict like the one we're seeing with Willamette Falls?
So in all the things that were on my potential veto list, the 3 bills and the 1 budget item, I think you'll see a consistency of there were questions, and I want to make sure I'm asking all the questions I need to have answered before I make a decision. As it relates to Willamette Falls Trust, $45 million in lottery bond allocation is a substantial allocation to a private entity. I just want to make sure we understand how the money is going to be spent and what it means for the entire Willamette Falls area, not just for the Willamette Falls Trust.
In terms of that second part of the question, when it comes to your role as a governor with the tribes, do you see yourself as a mediator in this complex intertribal conflict?
Well, here's what I've learned visiting all 9 tribes in my second year in office. As the head of a sovereign government, as the state of Oregon, it's not my job to tell the tribes what to do. What I can only do at this point is making sure that dollars that are being spent from state taxpayers is spent well and is comprehensively solving the problem at the falls.
Just one more, that's all right. We've got time.
Yep.
Just wondering, do you have the votes that you're gonna need for the special session to get the transportation package?
I suspect we will be successful on August 29th to pass the transportation package.
Thanks, everybody. Thanks for coming. Thanks, Kevin.
Thank you, everyone. Appreciate it.
Oh, well, there you go.
Right? Important thing.
It's like, I can squeeze this in, but I have to get to the dentist. Well, I'm glad because we get to squeeze through it. Thank you.
Thanks. Those are mics. Those are hot.
Huh? You want one?